All right, and I think I'm live and on the air with this episode of Back Talking. I am Todd Wagurski, and I am the host of the show. And this week, trying something a little bit different. In the past, I've been running a kind of what is causing your lower back pain series. And I would select topics. We talked about all kinds of things from facet syndrome to canal stenosis to herniations and arthritis and so forth. But this time around, I just wanted to open it up and just have a open forum and just say, hey, I'm here. What would you like me to talk about? So I know this is the first time doing this and didn't promote it very well, so we'll see if anybody jumps in. But I just wanted to, start talking, and here I am. And I love the blab episodes because it is a visual element, and it is hard to talk about anatomy and physiology and all that fun stuff and show MRIs and x-rays without visual. So it's one thing to talk about it. I am not Vin Scully. I cannot paint a picture like some of these great broadcasters can. So the blab episodes been met with pretty good feedback so far. People enjoy them. But maybe you're finding me for the first time and are wondering who I am. So again, I am Todd Wagurski. I am a doctor of chiropractic, and I live and practice in Cary, North Carolina. Cary, North Carolina is a suburb of Raleigh, and today it's kind of an overcast, dreary day. I've been doing this for about 20 years. I've been in private practice since 1997 when I graduated from New York Chiropractic College. Moved to North Carolina in that year and have been practicing ever since. So I spent 20 years in the trenches helping people with back pain. I'm very active, can't even speak today, very active, was always into athletics. Boy, can't speak very well. Very athletic, chased anything with a ball, played baseball, played soccer, played hockey, still play hockey to this day. And I've always been interested in the human body and what makes us perform better, or what separates the elite level from just your average player. So that is of great interest to me. So my frustration with back pain, if that is the correct word, maybe not frustration is the word, but there's a lot of information out there. Some is good, some is not so good. And my frustration lies with several forums out there which are supposed to help people that have back pain. In these forums, you can write in and ask a question, and you get responses back from others that are dealing with a similar episode as you. Or you may get a moderator, which will respond. These moderators kind of just must have nothing else to do but sit at home and moderate these forums. And typically they are full of just poor advice, and that is the frustration. They're very biased. And even though you are not supposed to hand out medical advice, people do. And that is the shame of this. So that is why I created this Back Talking series, is my way to help those who are struggling with back pain, and hopefully I can find some answers to them or for them. So please join in if anybody wants to have a question or wants a certain topic they'd like for me to talk about. Join in and ask me a question. But otherwise, back pain, it is at epidemic proportions, and it doesn't get the press because it's really not life-threatening, although it can be significantly life-altering. It doesn't get the attention that, say, heart disease or cancer does. Even when you visit your MD, it is not a high priority, and that is kind of what is led us down this path and has got us into the trouble that we have today. So what I want to just, until somebody jumps in and asks me a question, I just want to review some statistics that are just rather mind-blowing and kind of talk about the state of back pain and why we're having the issues that we're having today. So let me start off with some statistics. So essentially, back pain doesn't discriminate. It affects the young, old, women, men, couch potatoes, athletes, everybody. It doesn't matter if you live out in the city or live in the country and work on a farm. It can get anybody at any given time. But even though we don't hook up the wagon or plow the back 40 to feed our family, it's out there and it exists. And 80% of the population will experience back pain at some point in their life. 80%. So 4 out of 5 of us will have back pain. But what is, that's kind of understandable. We do some stupid things from time to time. We help our neighbor move the couch, or, we clear out the garage and maybe we just lift improperly, or just the cumulative effect takes its toll on us and we have issues. But once you have an issue, so of that 80%, 50% will have a recurrence of that problem every year. So let that soak in for a second. Half of that 80% will have a recurrence of that every year. So that's a pretty significant issue for us. Now, low back pain, it accounts for about 27 million visits to the doctor a year. 27 million patient visits. It places a tremendous burden on our healthcare system. Neck pain accounts for 10 million visits. The costs associated with back pain have increased about 50% over the past 15 years. Back pain, it's the number 2 reason for visits, only behind the common cold. It causes more disability than any other single medical condition out there. Wait, lost my place. Causes more disability than any other single medical condition in the world. So back pain is number 1. Neck pain cranks in at number 4. Direct costs have been associated at $102 billion a year. And when you add in indirect costs, such as lost work days, lost worker productivity, that number approaches about $200 billion annually. So pretty significant numbers. It places a lot of burden on the healthcare system. All right. So most of that spending that we just talked about, the increase in spending is due to MRIs and specialty visits, not necessarily in treatment, but the bulk of it is in diagnosing back pain. MRI studies are ordered very frequently, and an MRI in my area, it depends on where you head to, but it can run between $2,000 and $3,000. So it's a fairly significant cost associated with just a simple diagnostic test. But with all that increased spending, we're not getting any better at chewing into the number of people that are affected in any given year. So spending more money, it's more of a burden, more doctor visits, and guess what? We're not doing any better at limiting it. So that's why I say we're at an epidemic levels when 80% and half of those will have a recurrence in any given year. So we struggle with it. It's the number 1 cause of disability in the United States, and back pain accounts for 25% of workers' comp claims. So 1 out of every 4 workers' comp claim filed is back pain related. It's the number 2 reason to miss work, behind, again, number 1, the common cold, and maybe some of those are bogus, but number 2 reason is back pain. And it costs our employers $61 billion a year. So that cost gets passed on to your employer. And the average workers' comp claim for back pain is $20,000. So pretty significant number, $20,000 for a workers' comp claim. So that cost, obviously, like I said, gets passed back to your employer. Now, 20 years ago, when I was going through school, the general thought is that back pain was self-limiting. That, hey, in 6 months' time, if you can ride it out, you will be fine. You'll be better. It'll feel good. But research has shown that that's not the case. Like I was saying, 50% of people have a recurrence every year. So 50% so here's some statistics, 50% of low back pain patients experience persistent pain for about 12 months following its onset. Between half of those who report neck pain continue to experience neck pain 1 to 5 years later. So that self-limiting, 20 years ago, going through school, it was thought that 6 weeks' time, like I said, ride it out, deal with it, get treated. In 6 months' time, you'll be fine. But now long-term studies are showing that half of low back pain people have pain 12 months later, and half of those who have neck pain have pain even at 5 years, 1 to 5 years later. So this is not a self-limiting disorder. So again, it's the compound effect. We see the numbers rising. We see more people ever with disability ratings for back pain. It's out of control. So you start to dig in and say, why are we having this problem? What has led us to this epidemic? And there's general confusion. There's confusion out there for people. You have back pain and it's like, who do you see? And we get advice from friends, family, coworkers. Everybody's trying to help, but what works for one may not work for others. So the confusion is that, you have back pain and it's like, who do you see? Should I go see my massage therapist? How about my personal trainer? Hey, last time I was able to work it out. How about my primary care physician, my general practitioner? How about a chiropractor? Maybe my a physical therapist that I saw in the past. How about an orthopedist? What about a neurologist? How about an acupuncturist? The list goes on and on. I mean, it just, we have many options. And like I said, what works for some doesn't work for others. Number 2, mismanagement at the primary care stage. So there are guidelines out there that basically outline how one should handle, how a physician should handle a low back pain patient. And these were published about 10 years ago. Recent studies show, though, that providers are not implementing these guidelines appropriately, especially with regards to advanced imaging, referrals, and invasive procedures. And this was published in Spine, the Journal of Spine, in 2009. Don't shoot the messenger, I'm just reporting the facts. Treatment that is incompatible with the guidelines is associated with higher overall costs related to spinal-related disorders. So, again, the guidelines state that you watch and wait. Obviously, if there's trauma involved, or if you're suspicious of a fracture, or either cancer, a tumor, an infection, there's other signs that may lead you down that road. Obviously, you order imaging to see what's going on inside of the person. But typically, if you just come in and say, hey, I got low back pain, no, you do not order an MRI. But unfortunately, most primary care physicians do. And that is one of the first things they do is that, oh, you need an MRI, and off you go to the MRI center. So there's one reason for increased cost overall is, too much imaging taking place. What is an issue with an MRI is that there's a lot of false positives with MR. And what do I mean by that? So especially in the low back, 1 out of 3 people will have a herniated disc. 1 out of 3. So you can put 3 people in the machine, 1 of them will have a herniation. And these are asymptomatic people. Let me back that up. I'll explain that a little bit better. If we take 3 people that have no back pain whatsoever, we stick them in an MRI machine, 1 of those will show a herniated disc, even though they have no problem. So again, a false positive. So say you have back pain and we put you in an MRI machine and it comes back positive, and we say, oh, there's the cause, you got a herniated disc. So a lot of false positives can send you on a wild goose chase. In regards to neck pain, it is 1 out of 2. So we take 2 people, stick them in an MRI machine, we scan their necks. 1 of those people will have a herniated disc in their neck. And guess what? They have no symptoms. But, so again, you can see it's a false positive. Oh, you got a herniated disc in your neck. This is the cause. Maybe not. This led to a big epidemic of, not an epidemic, that's not the right word, but in the 1990s when CT and MRI first became, very popular, we had people getting scanned left and right and coming back with false positives, but it was, they'd go off and have surgery. They'd wake up after the surgery and guess what? Hey, I still have pain. Well, you just operated on something that wasn't the pain generator. So that's just a side note about MRI. Now, the standard general practitioner treatment, you go to your GP, you will get a painkiller, prescription painkiller, and typically an anti-inflammatory or an NSAID, a muscle relaxer such as Flexeril and Scalaxin, and advice for rest. All of these treatments are focused on symptoms. They really don't get to the cause of what the issue is, and there's no to little evidence out there that shows that it has any effect on treating the cause. Relief of pain is deemed the primary objective of treatment, while often finding the true cause has been neglected. The approach where a patient plays a passive role in their treatment, i.e. popping pills and resting, has been a major failure. The broad impact of neuromusculoskeletal conditions on society and on our limited success in managing it warrants a totally new approach. Back pain is often seen as having a low priority because back pain is considered a non-life-threatening disorder. It doesn't get the attention of your primary care physician, as other disorders do. In one interview, primary care physicians perceive back pain as a low clinical priority and uninteresting in comparison to the major chronic illnesses such as heart disease, diabetes, that they must manage with their patients. And in that same study, primary care physicians said that if they could shift this population of patients to a non-physician, a non-MD provider, was perceived as a positive step in alleviating their burden of work. So basically, primary care physicians in an interview study in the British Medical Journal came out and said it was uninteresting and they would rather deal with other stuff like heart disease and diabetes. And please, yes, shift this to somebody else and take it off of our plate. Go figure. In that same study, show that spinal-related disorders may be challenging They lacked clinical confidence in treating it and managing it appropriately. They lacked clinical confidence. And in another study, primary care physicians lack confidence in their ability to assess and supply evidence-based care for back pain, and that some expressed anxiety about not being able to help or give adequate explanations as to what was going on. So, again, not bashing my general practitioner counterparts, their knowledge is a mile wide. They have to know so many different disorders. So their knowledge is just incredibly vast. So it's a mile wide, but it's about an inch deep. And when you start dealing with backs, bad backs or necks, you don't need an inch deep. You need a mile deep base of knowledge. Exercise rates in the United States. What else has led us down this road to the epidemic? Exercise rates in the United States. 80% of the people 80% of Americans rather, do not get the recommended exercise that is in the guidelines. And this potentially sets ourselves up for years of health problems. What is recommended? 2.5 hours per week of moderate intensity exercise, so that's about 30 minutes a day, or 1.25 hours of vigorous intensity exercise. And adults should be doing some type of muscle strengthening exercise or activities at least 2 times per week. So 4 out of 5 people are not even getting close to the recommended guidelines for exercise. Sitting is the new smoking. This is another thing that it's getting a lot of press of late. And, they estimate that 1 out of 10 deaths worldwide are caused by people just not getting up and engaging in some form of physical activity. This leads to increased obesity rates, increased risk of type 2 diabetes. And sitting is one main activities that puts a lot of strain on our lower back. Our modern lifestyle. What else has led us down the road of having this issue? And this is another one that just kind of blows my mind, is that all age groups spend as much time in front of some screen, be it a PC, a laptop, a tablet, a phone screen, as they do asleep in bed. If you're older than 55 years old, you spend on average about 6.6 hours in front of a screen. 18 to 24-year-olds spend on average 8.83 hours in front of some screen. And not surprisingly, 84% of 18 to 24-year-olds admitted to suffering from back pain in the past year. This age group loses more working days to back pain than those in their parents' generation, about 1.5 days more. Their pain is more likely to be experienced in the upper back or neck. Guess what? From looking at a tablet. Obesity rates. Now, these numbers just blow my mind, absolutely just blow my mind. 35% of adults older than 20 are obese. 35%. 69% of adults over age 20 are overweight or obese. 18% of 12 to 19-year-olds are obese. So almost 1 in 5 12 to 19-year-olds are obese. 18% of 6 to 11-year-olds are obese. 12% of 2 to 5-year-olds are obese. Can you imagine that? The obesity rates are just skyrocketing. So, just to recap, we have 80% of the population that will suffer from back pain at some point in their life. Of those, 50% will have a recurrence every year. So this has placed a tremendous burden on our medical system, as it is the number 2 reason for doctor visits. The costs associated with dealing with back pain, disability, and lost worker productivity is staggering. It places a huge burden on our society. What has led us to this? The so-called healthcare funnel has let people down. Care is being mismanaged at the top of the funnel by physicians who don't see it as a priority. They have little to offer in the way of care in an area that they're not even comfortable handling. Our modern lifestyle and modern conveniences has caused our activity levels to drop. We sit more than ever. We spend staggering amounts of time sitting in front of some type of screen. Before it was the TV, but now throwing cell phones, tablets, and computers. We're fatter than ever. And the problem is only getting worse when you look at the childhood obesity stats. And what really bothers me is that the generation, like my kids' generation, isn't going to live as long as my generation will. For the first time ever, we're seeing a decline in our overall mortality rates. How long are we going to live? It's starting to slide the other way because we don't move. We're fat. We don't exercise. And we wonder why we have back pain. So that's kind of my soapbox rant. I know I've talked about some of these things before, but it's just occasionally you got to throw it back out there and wonder why we're having the problems that we have today. We're heading in the right direction. There's some promising treatments as far as finding the cause. It's complex to say the least. I mean, there's lasting muscle changes. Our nervous system kind of rewires itself. We're digging into what's going on in the brain. Why do we start moving differently when we're in pain? And once that pain goes away, we continue to move in that way that kind of sets us up down the road for future problems because we're not moving as efficiently and as well as we possibly could. So that's an exciting advancement, is just finding movement disorders and correcting them. But we got to get people into the right funnel. The answer is not popping pills, a painkiller, muscle relaxer. Hey, you're good to go. That is not the answer. It's not working, and it doesn't work. So again, I'm Todd Wagurski. I'm a doctor of chiropractic, and I'm like to hear from you. I'd like you to reach out to me. You can email me, todd@backtalkinghelp.com. Again, it's todd@backtalkinghelp.com. Let me know what your troubles are, what you're dealing with. I'd like to help. We have this forum. This is beautiful. Hey, I was ready. I'm waiting for a question. I have my screen behind me. I can show anatomy, MRIs that help explain, understand what you're dealing with. And let's go from there. I know this is the first time. I'm going to keep coming back until somebody chats with me. So I'll see you guys next Friday or next week sometime. I know it won't be on Friday. I have a prior commitment. So maybe next Thursday I'll jump on the air and we'll do an open forum. So in the meantime, again, reach out to me, Todd@backtalkinghelp. Let me know what you're dealing with. Again, don't worry, it'll be kept confidential. I'm not going to pull you out on the air and see what happens. So take care, people, and I'll see you next time.